interesting subject today. It is something that, as a mother, as a female, I think about all the time, and I know you think about it too. We're talking about plastic surgery. Let's be honest, at some point in your life, you've probably thought about it. From Botox to breast implants, it's almost as if everyone has had something done. And whether you have or you haven't gone under the knife, you may have been influenced by this show on the E! Entertainment channel. It's Dr. 90210. Whether you're grossed out by the surgeries or absolutely glued to the TV thinking, what can I do to get myself to Beverly Hills so I can get that done? Well, guess what? You don't have to go all the way to California to get the kinds of treatments that you see on cable TV. Two doctors right here in San Antonio have teamed up to offer women a chance to, and this is how I say it, put things back where they belong. Dr. Constance Barone is a board-certified plastic surgeon who was named top doctor in San Antonio in 2006, and she is also the chief and past director of plastic surgery at the University of Texas Health Science Center. And Dr. Troy Hailparn is board-certified OBG and the only female doctor specifically trained by the leader in laser vaginal rejuvenation, Dr. David Matlock. And several doctors have been trained since then, but she is the best doctor here in San Antonio. And of course, you know, Dr. David Matlock is one of the doctors on Dr. 90210. So thank you both for being here this morning. And y'all have something very exciting to announce to San Antonio.
Yeah, we're talking today about Mommy Makeover Combo, which is not only the plastic surgery aspect of breast rejuvenation, abdominoplasty, but laser vaginal rejuvenation.
So it is something that a woman can go in one time and deal with all of the problems that we're facing as women.
Correct.
Okay, so what does this entail? Because there's several different procedures that you can do.
Correct. Well, we first have two separate evaluations for the patient. Troy and I both evaluate the patients separately. And she evaluates them from the gynecology aspect of their problems, and I evaluate them from the plastic surgical aspect. So I address their breast problems, whether they're sagging or whether they need to be augmented, in their abdominal area, in their hip area, whether they need liposuction combined with their abdominoplasty.
Because those are the two areas that we hear most about. When you've had children, you hit the 40s, things go south. And we also have a hard time getting rid of some of the flab around our middle. But there's also something that we don't talk about that much, but it is starting to become more talkable, and that's vaginal tightening. And that's where Dr. Hailparn comes into play.
Absolutely. Reversing the effects of childbirth, a lot of women want to do. They get bladder, bowel, and sexual function issues, and they're not all addressed appropriately. And some women who may leak urine when they cough and they sneeze, and who also have changes in sensation, with intercourse, or other issues related to tampons and bowel function, they have options for having these things corrected.
And here's the thing, ladies. I know you might be cringing, going, oh my gosh, what are you talking about today? But we want to hear from you. So we're taking your calls, 470-5444. And I've had two kids. I had a C-section, so I didn't have to deal with any of that. But I have friends who have kids, and they tell me, everyone knows things aren't the same after you have babies. They're just not. And so I think it's really great now that women are able to talk about this a little bit more, and they have somewhere to go to talk about this. What do you think about adding it all together into one group and making it easier for women?
Well, I think it's easier for, we're talking about moms here. Moms are very busy, so it's not like they can afford a lot of time for recuperation. Yeah. And so I think the hesitation in both, going forward in surgery is the risks, the possible risks of surgery. They want to do it in one step. In the post-op complications, as well as dealing with the post-op recovery, they want to do that in one package.
Sure. Let's talk about number one on probably most moms' lists, and that has to do with a breast augmentation. You do lifts, you do make them bigger, make them smaller.
Correct.
What do people need to know when they're going to talk to you about that?
Well, they need, I evaluate them both. I was, boarded in general surgery as well as plastic surgery, and I evaluate them both from a healthcare point of view as well as what their cosmetic appearance looks like. And if they're over a certain age, I want to make sure that they've had an examination and a mammogram. And then we talk about the alternatives of silicone versus saline, and there's a variety of incisions, including transumbilical. And when you do the transumbilical with an abdominoplasty, it's virtually scarless around the breasts. So it just depends on the individual package that I'm presented with,
Sure.
and then I tell you your individual options.
So we've got the breast reduction augmentation, and then from there you go to maybe some liposuction around the tummy. It's perfectly fine to do all those things at one time?
Correct.
Okay.
As well as a tummy tuck.
Okay.
I often combined abdominoplasty with breast augmentation and a little bit of liposuction. That's a real common procedure that I do. But combining the vaginal aspect to this really addresses a problem that women, I think, up until this point have been rather shy to discuss, and they just don't know that it's available.
Okay.
Okay, a solution is available to them.
And we're going to talk to Dr. Hailparn in just a second about what the vaginal tightening includes, but we've got a caller on the line. Irma, good morning. You're live on San Antonio Living. Did you have a question for the doctors? I think we just lost her. Her question was, if she has diabetes, is it okay for her to undergo some of these procedures? What's the talk on that?
Well, I think diabetics are at an increased risk, and I think that's a totally different level of evaluation that we have to do, and it depends on the severity of the diabetic as well.
Let's talk about laser vaginal rejuvenation, because this is something different than what it was years ago. Who really could undergo this kind of process? And women out there who are listening are like, oh, this is interesting. I think I fit into this category.
Well, anyone who's had a child is definitely a candidate, because the vaginal canal goes from a nice round tube to a kind of stretched flat tube.
Yeah.
And the organs that are in front of it and behind it start collapsing in. And it can be just a little bit of relaxation or a lot of relaxation, and it can be the first child or it can be the fifth child. Every body is different, and how your tissues respond in terms of how they heal and elasticity after delivery and how one is repaired all have an impact on how much is affected. But you don't have to have the stress incontinence or the bowel function issues. You can only have the sexual function issues, and in reality they're not treated in and of themselves.
And it's something that's done with a laser, too, right? So it's not going under the knife or anything like that.
Well, it's still surgery, and the laser is a substitute for the scalpel, and it brings the surgery up to the next level by reducing blood loss, by reducing infection risk, and by getting the patients feeling better faster.
All right, so it's called the Mommy Makeover Combo. It's everything that you moms talk about and we moms talk about, and it's all in one package. If you would like some more information on that, or if you'd like to talk to one of our doctors, we've got all that information for you. First of all, Dr. Troy Hailparn, you can find her at LVRI of San Antonio. There's the phone number for you, 615-6646. She has also got a great website where you can get some answers. You see it there on your scene, cosmeticgyn.net. Dr. Barone, you can find her in Santa Rosa Northwest, Tower 1. Her phone number is 614-0400. You can find her online at baronecosmeticsurgery.com. And by the way, we've got the information for where you can find the combo. MommyMakeover.com is where you can go. MommyMakeoverCombo.com is where you can go to get all the information. There it is on your screen right now. So thank you so much for bringing this to San Antonio and giving women a chance to, I don't know, feel good about ourselves again.
Thank you very much. Thank you.
Thank
Happy
you
holidays.
so much.
I appreciate being here.
Coming up.